Morning, everybody. We'll get started here in a minute. I think Brent seems low. Maybe you should get somebody over by Brent.
Oh, okay. I know.
Good morning. Thanks all to the media for being here today, and thanks for those that are here in person, and thanks for all the people that might be watching online. I want to start with gratitude this morning to our North Dakota team members across the state at all levels, especially those here in the North Dakota Department of Health for their tireless efforts to prepare for, to prevent and contain and mitigate the spread of the coronavirus. I want to thank the members of the press that are here, as I have at previous meetings, for their work in North Dakota to provide timely and accurate information about this dynamic and changing situation to all of our state citizens. As you know, we're here this morning for this conference because last night the Department of Health confirmed the state's first presumptive case of the novel coronavirus disease, or COVID-19. The individual, who is in his 60s, male, has not been hospitalized, is currently self-isolating and recovering at home. Prior to this, the man who has been confirmed with the state's first presumptive case had traveled out of state, where he became aware that he had had contact with a person who has since tested positive for the disease. This, of course, is called travel contact, and I guess we take this as a piece of good news because we actually know how the person who they had contact with and how they contracted it. The health department is waiting, as is the standard protocol, for the CDC to confirm the positive results. So after we've had a positive test here, the double check occurs with CDC. In the meantime, our team members in the Department of Health are working to identify any individuals who may have come into close contact with the individual to help us identify who may have been exposed and help us further prevent the spread of any COVID-19 in North Dakota related to this contact. As of this morning, Department of Health has tested 27 individuals for COVID-19. 12 tests have come back negative, which is, of course, positive. Results for 14 tests are still pending. In terms of broad, communication to the citizens, it's pretty straightforward, which is we want to be making decisions on facts, not on fear, and we want to focus on preparation and avoid any panic. We do need to take this virus seriously, just like we have in all years past taken the influenza season seriously, because these viral diseases have the ability to cause illness, and as we know, they can even have mortality. So we need to take it seriously, but we also need to make sure that we understand that the risk to healthy North Dakotans is low, and we need to make sure that there are things that every individual in the state to do that can help stop the spread of this virus. And some of those are basic. Some of these are things that we've been teaching our kids our whole lives, things that we learn from our own parents. And number one on that, of course, is wash your hands frequently. And soap and water, good old soap and water, works great. As they say, 22 seconds or more. I've said before, I think you got to sing happy birthday twice to yourself. It's going to seem like a long time. But washing your hands, and when you're number two, stay home when you're sick. We in North Dakota, we even like the phrase North Dakota tough. We can be North Dakota tough, but right now North Dakota tough means making the right decisions about protecting yourselves, your family, your friends, and your coworkers, because there has been a culture in our state that if you're ill, that you're the strong one if you still get up and go to work, even if you're not feeling well. And today, in 2020, there's lots of ways where you may be able to contribute to work from home. And so again, we're really encouraging people to stay home when they're sick. If you do have a cough or a sneeze, cover that with a tissue or in the sleeve of your arm. Never cough into your sneeze into your hand. If you do, repeat number one, go wash your hands. And then, of course, if you've got frequently touched surfaces, whether at home or work, places where lots of people would be touching them, good to have those things cleaned. And again, we would advise people, if you're just out in in the community. There are places, like ATM machines, like when you're pumping gas, those would be considered frequently touched surfaces that often don't get cleaned. So after those kinds of activities, again, good idea to wash your hands with soap and water. As we've seen what's happening in other countries, and we've watched what's happening in other states, we know that we have what we're observing here is a pandemic, not the first time that this has ever occurred on our planet, and they'll continue to occur, but the World Health Organization has declared this a global pandemic. As North Dakotans, we need to be prepared for the understanding that there are going to be more test cases that test positive, and that's going to be a function of two things. As more contact occurs, then just like the flu, this will keep spreading, but also as we do more testing, we'll have more results. And as you saw from the stats earlier, there's been very limited testing in North Dakota, so it's highly probable that there are other existing cases of the coronavirus in North Dakota today that have not yet been identified. And part of the reason why that may be the case is because the symptoms can be very mild in some people. Because we've got the potential for spread, we need to prepare accordingly, and I think we need to set expectations that, as you may have already seen and you could see in the future, there's going to be canceled travel, events, potentially canceled school events or conferences events, and part of that is to avoid transmission through creating large crowds. Again, if you've been exposed to a family member who's been sick, even if they think it might just be the flu, again, you need to take extra caution about who you expose yourself to. The CDC website has considerations on how to prepare at home, at work, at school, and travel guidelines, and we're also working on updating those protocols for the state of North Dakota. At the state level, we're taking a whole of government approach, and this is something we've done every time we faced a statewide emergency, whether it's been a flood or whether it's been a drought or whether it's been another type of emergency situation. We want to pull together all the resources of the state of North Dakota to serve the citizens of North Dakota. Our North Dakota Department of Health has been staffing its Emergency Operations Center since January when we first heard about this. So we've been operating for over 2 months. Today, we're going to be expanding that operation with members of our Unified Command, which includes North Dakota Department of Emergency Services, North Dakota National Guard. We have our Adjutant General, General Alan Dorman, here with us today as part of this. They have been part of these meetings prior, but we're going to work in even more tighter and broader fashion at the point. But today was kind of the day that we've been preparing for 2 months, was the day in which we had our first positive case. As we look at measures to protect North Dakotans, we really want to focus our resources, and it's important that we focus our efforts, especially on those that are elderly or those with chronic health conditions such as heart or lung disease. And we also have to remember that there are some special needs children with chronic conditions, so we can't forget about our kids. But as we've stated earlier in meetings, the early data on this has got one bright spot, which is that in relative to the flu, infants, children, and young adults appear to be less at risk from mortality from coronavirus than they do from the regular flu. As a matter of fact, 2 days ago when we were on one of our federal calls, it indicated that there were no cases had been confirmed of anybody under age 9, and only one, there had only been one mortality of someone under age 18, and that was a young individual who had cystic fibrosis, which you know is if untreated, a terminal disease with an average life expectancy of about age 30. So again, this is hitting elderly people more than it's hitting youngers, and in that sense, we have to really pay attention to what we're doing. We have 80 skilled nursing facilities in the state of North Dakota. Last night, we had a meeting with the health department. We've had calls, 2 calls earlier this week with statewide calls with dial-in to meet with all the leaders from those skilled nursing facilities and assisted living facilities. We've been working with the North Dakota Long-Term Care Association, North Dakota Hospital Association. There There are a set of protocols that have been adopted by the national organizations for long-term care and skilled nursing, and those agencies or those organizations in North Dakota intend to adopt those, and we're going to be working as a state to ensure that those protocols are adopted, and a lot of those protocols relate to visitation at these facilities. The key would be to make sure to protect the elderly as we keep the virus from getting into those facilities, and we do that through strong screening and in strong policies in terms of who can visit and can't. So nationwide, the response has evolved, really more towards mitigation, because the key to slowing, if we can slow the rate of spread of this disease, that takes pressure off of our community health organizations, off of our hospitals, off of all the people that are providing services to support people that have become sick. And so again, because there's no, quote, cure for COVID-19, if you stop the spread, you think of it as a curve. There's always math involved in these epidemics, and if it spreads rapidly and a lot of people get sick in a short period of time, then that can put enormous pressure on our healthcare system. If the exact same number of people actually end up getting sick, but it occurs over 3 months instead of 3 weeks, you take that peak out, and then that allows us to make sure that we have the ability to serve through our healthcare system those people, and we should then have better outcomes for the people that we're serving. So part of what the strategies that we're deploying here are trying to avoid a rapid spread, which would create a steep peak, and we have to kind of spread this out over time. The lab here in North Dakota, the Department of Health, is working on increasing their testing capacity. We know that in other places in the world, such as Korea, they've gone to drive-by testing, which would mean then an individual who may suspect that they don't have may suspect that they've got symptoms actually don't even have to get out of their car. The people that are administering the tests, we don't end up infecting medical facilities. So we're taking a look at all the best practices on how we can increase testing. But right now, people with mild symptoms should just self-isolate. If you want to have contact with your health provider, give them a phone call as opposed to walk in. And only those individuals with severe symptoms should go in, but you should always call before you go in. We do not want people just showing up at emergency rooms saying, I think I've got the coronavirus, because we would want those emergency rooms to be able to prepare to receive you before you come in. So call before you come in, and if your symptoms are mild, then step one is just self-isolate at home. As we know, there are antivirals that exist in the marketplace under brand names like, Tamiflu and others for when you have the flu, and we know the flu season is still going on in North Dakota, and you can get tested. There are people that get tested, they've got influenza A, but there are no antivirals for COVID-19. These are things that would help address the symptoms. So the best course of action is just stay at home, drink lots of water, wash your hands often, and avoid contact, particularly with those people that might be more vulnerable to either the flu or to the coronavirus. And again, all of these are goals, as we say, is to flatten that curve, distribute the impact over as long a period as possible so we don't overwhelm our healthcare resources. Yesterday, the CDC released a 4-part framework for community mitigation that relates to how we can prevent and slow the spread of the disease in workplaces, schools, homes, and commercial establishments. And so we're going to be continuing to distribute those out to folks. And again, as we think about those that are most vulnerable, if you're at very low risk, if you're a healthy individual, but we need to think about those, whether it's parents, grandparents, coworkers, neighbors, or others, is who we've got to be thinking about right now. We know in North Dakota that one of the things that makes it great to be in the state is that people care about each other, and often that caring has been, if there's a crisis or a situation, part of what we do is, everybody comes over with a hot dish. Everybody knocks on the door and says, what can we do and how can we help? And we have to maintain our ability to be to this great caring state that we are, where we've always had deep concern about our neighbors. We got a great sense of community, but how we think about our actions now, we've got to think before we act, because in some cases it might be better to call that neighbor versus just drop by. And we also know that when people isolate, that can create risk relative to mental health issues. And so if you know someone that is home that's self-isolating, this is still a good time to reach out to them. And we got all the great tools. I mean, whether you want to, FaceTime or Skype or check in or give a phone call, there's things that we can do to make sure that we're taking care of each other, but also reducing the potential spread. In closing, I want to thank the whole team that's up here. We've got a great group of folks that have been working, and thankfully they haven't been working around the clock every night. I know they were last night, but Mylin and Kirby and Tim and Christy and our entire Department of Health team and all the team members across the state of North Dakota who are working so closely with the federal partners, with the local partners in terms of how we do that. And I would also just say on behalf of Lieutenant Governor Brent Sanford and myself, we have to say that at the federal level, whether it's the CDC, the Surgeon General, CMS, all of the Department of Human Services, and particularly the White House themselves, Vice President Pence, we've been on 2 phone calls with him. He's given out his direct contact phone number to all the governors in the United States, and I know that he has been directly working to try to resolve situations for North Dakotans, including North Dakotans that were caught on the Grand Princess cruise. And so we're so pleased with the support that we're getting at the federal level, and particularly out of the White House, where they're being incredibly responsive and putting all kinds of resources forward. And as you know, we just approved on Tuesday the approval of nearly $6 million at the Emergency Commission meeting. Some of you were there, but the federal government approved $8.3 billion in record time, passed both houses, signed by President Trump, of additional resources that could be used by the states, and nearly $6 million of that could be eligible to come here to North Dakota, and the team is working to make sure that we can receive that and deploy that in a way that makes lots of sense. So in closing, I do want to just say that, again, we're going to continue to work with all the state and local leaders, and whether those are educational institutions, faith-based businesses. We've had statewide phone calls with all of those groups earlier this week. And we need to continue to coordinate again with the private sector, nonprofit leaders. At the state, we're taking a whole of government approach that we're doing. But again, in the end of the day, it's going to be individual actions of our citizens that will help slow the spread as much as anything that we can do as a government, as often is the case. Individual responsibility, back to those basics of making sure that in terms of how you're taking care of yourself and your family and playing your role in helping prevent and mitigating the spread of this. And again, we ask everyone, focus on facts, not on fear. Be prepared as we are, and let's avoid the panic that we maybe have seen in other places, because we know that as North Dakotans we can pull together and get through all this. We're responsible not only for protecting ourselves, but also those around us that are most vulnerable. And I would ask again people to step up and help support. If you've got skilled nursing facilities in your community, that's our area of primary focus that we're going to go on forward, because again, we want to protect those that are most vulnerable. We're going to have some other speakers here this morning, and then we'll do Q&A. Again, thanks to the media for being here, and thanks for your important role as we work through this emergency. And next up, we'll introduce our leader for the Department of Health, who's been doing a fantastic job, Mylin Tufte. Mylin.
Thank you, Governor Burgum. It's always hard to follow Governor Burgum because you can see his leadership is superior, and his support for the work that we're doing at the Department of Health and across the state is amazing, and we really appreciate that. I wanted to also thank the state agency partners that have come together and have been preparing for this day that we knew was coming. Thank you to our healthcare providers and the community health leaders that we have been talking with as we prepared for this day that we knew would come, but we are ready for it. So I'm especially thankful for public health's leadership and the role that they've played. We've also seen our tribal leaders step up and take serious measures to limit travel and protect their citizens. At the North Dakota Department of Health, we've been looking at the facts, taking them into account so that we can make recommendations that are aligned with the guidance that we're seeing at the federal level. This includes talking with our businesses, our faith-based organizations, our K-12 and higher education universities, and all of the, especially also corrections and rehabilitation. As the governor said, this is a whole of government approach. We're taking a statewide approach and how we prepare for this, and we want everyone to play their part. Everyone has a role to play. At Team North Dakota, we talk about leadership everywhere, and that applies for us, that anyone could be a leader wherever they are. And for you, wherever you are in the state, you have a role to play. You can be a leader. You can help us get the facts out, prevent illness, stop panic around this illness. We can do it. If anyone can do it, the state of North Dakota can do it. So I also wanted to say this morning we're going to be sending a memo to our long-term care facilities. We have been in talks with them. We want to help support them in every way we can. We will be recommending that they follow the national guidelines from the American Healthcare Association to limit visitors. And I know this is hard. You want to be in the facility where your family member is, but right now, in order to protect them and to protect yourself, we're asking these facilities to limit visitors to only essential visits, visits that may be around end of life or very critical situations. So I ask for your patience, and I ask for your grace to these facilities, that they're doing their best to protect the people that are there, not only the patients, but their healthcare workers. We know in North Dakota there is a shortage for healthcare workers. There's a shortage for nurses, nursing assistants, and we need to do everything that we can to support and protect these individuals. So with that, I want to just say thank you for everything that you're doing, and I'm going to let Kirby Kruger, our Section Chief for Medical Services, give an update, epidemiological update on COVID-19. Thank you.
Thank you, Mylin. So, as the governor has already mentioned, you know, this is our first case to be diagnosed in North Dakota, and this individual did have a history of travel during the incubation period, and that's an important aspect of this investigation. And as we know, because what we're trying to do is figure out, did the individual acquire this his infection locally, or is there another probable source for that? And so knowing that the individual traveled and likely was infected while traveling, that means that we're not really looking at community transmission for this particular case. He is isolating, self-isolating at home, and he is recovering at home. His illness was on the mild side. But this is an emerging situation, and in the world now we've had over 118,000 cases. I think what's interesting in the world is when you look at the epidemiology of this, what's happening, you know, we used to look at, you know, this is a problem just in one part of Asia. It's not a problem just in one part of Asia. What's happening in that part of Asia is that the number of cases has plateaued, and what's happening in the rest of the world is that we're seeing dramatic increases in the number of cases. And so there's been a shift in the epidemiology of this since it started. In the U.S. this morning, when I looked at the CDC website, we have 938 cases in the United States, 29 deaths, and at least 39 cases reporting. Ours wasn't on there yet, so we know that there's at least 40 cases now. In North Dakota, we continue to monitor 7 people who have returned from travel, and that means that 26 individuals have been monitored in total, are in the monitoring process. Laboratory testing is ongoing, and providers continue to call for consults. We have tested 27 people, as the governor said, and so those tests will come in on a daily basis. We don't expect that testing is going to slow down. And as the governor mentioned, and I can't emphasize it enough, and so I'm going to repeat it, is that there are things that people can do to help protect themselves and their communities. This is really a community thing as well. And top on my list is, if you're sick, please stay home. That's where you need to be until you recover. And so those are all important things. We heard these things over and over again. Avoid people who are sick. Wash your hands frequently with soap and water. Use a hand sanitizer that has a high volume of alcohol in it. Avoid touching your face with your hands. You know, the good respiratory etiquette. If you don't have a tissue, sneeze into your elbow. If you have a tissue, throw it away when you're done sneezing or coughing into it, and wash your hands. And then heeding the CDC and State Department travel advisories and warnings, as they change rapidly, and so it's important that you're keeping yourself up to date with those things. And people and families need to continue to prepare for this as well. And I talked about this earlier. You know, families and individuals need to now identify what their support networks are. Who are their friends and other family members that they can rely on to help them out if they are having to self-isolate at home or stay at home because they've been exposed. So people need to be able to also care for individuals at home. We know that the vast majority of people are going to have mild illness that will not require hospitalization, and these individuals can be cared for at home, but it needs to be done and correctly so that you reduce the risk for the others in the household. So, and then, if you're notified by the state health department or another health official that you have been exposed to COVID-19, you need to be prepared to be at home for 14 days. And that's important because that's part of what we're trying to do in containing this virus early on, is that not only those individuals who are ill, but those people who are at highest risk, meaning they've been exposed to somebody, need to be prepared to be at home. And then preparing for schools and school closure or child care closure is also going to be important, and the impact that has on being able to go to work or if other work arrangements can be made, that type of thing. So we are continuing to ask people coming from international locations, returning home from international locations, to take a survey on our website. And when they take that survey, they do receive information on what they should be doing to monitor themselves or to practice social distancing, depending on where they're coming from, and what symptoms to be looking for. And that's an important part of it, because we really do want these individuals to try to either separate themselves from other people as much as they can, or to avoid those congregate settings, and that's important for what we're doing here as well. So the other thing that the governor mentioned that I really want to highlight is that most people are going to have milder illness, and they usually will not need to seek health care if the symptoms are really mild. Now, if they become more severe, obviously we want individuals to call their provider and talk about the need to be evaluated by their health care provider. But it's important that they call ahead. I think one of the biggest messages we get from the health care community is that people are still just showing up, and so it's important that individuals who have respiratory illness, any respiratory symptoms, who are seeking care, make that phone call so that your providers can prepare to handle you in the safest way possible. So. We also know that individuals who are older and who have chronic health conditions such as kidney disease, lung disease, diabetes, that type of thing, they are at higher risk for severe outcomes. And so we do have some recommendations for those individuals as well. And we encourage them right now to reconsider any cruises that they may have planned or may be planning, or reconsider air travel, especially if they're going to be long distance air travel. If possible, they should start avoiding or thinking about going into large congregate settings. And then if they know there are people that are ill, obviously to stay away from those and keep their a distance from ill people. So our public health actions are multi-focused. It may seem like it's black and white. We are in a period right now where we still want to identify and contain, but there is no black and white line between these things. So we are also looking at the things that the community can do at the same time in implementing certain measures, such as all the things we talked about with the social distancing and that type of thing, and people taking care of themselves and washing their hands. All of that, there's no gray line. It all works together. There are right now we can emphasize, and we still are working on identification and containment, but eventually somewhere down the line we move to different measures that are more community-based. So the last thing I really wanted to mention is a little bit is this is a rapidly evolving situation, and it's really important that communities need to be prepared and to take action because it is evolving so rapidly. Some things may happen on short notice, and so that is important. I do want to talk just a little bit about laboratory testing before I move on. As you know, our public health laboratory it has been validated to run the test, and so generally the process works where if a provider feels somebody needs to be evaluated for COVID-19 or the virus that causes it, there's a consultation with an epidemiologist, and then we make arrangements to get that individual tested, and it comes in the laboratory. When the specimen comes in, then we can run the test. So there are several commercial laboratories on the private side that have begun testing. They have developed their own test, and this is something that us as a government entity, we don't control them. But there are testing that is available. But from what we hear through, our national organizations that we work with at the laboratory level, is that they are overwhelmed as well. And so testing is sort of a limiting factor in the United States from several perspectives. Although more private labs are trying to get geared up for this, and we're hoping that this situation will improve in the near future. As we mentioned earlier, this is a presumptive case, and so we do send down to CDC for confirmation, and the timeline for that is really unknown, as it depends on the burden on the CDC lab. But our test results at our lab, once we get a specimen, usually we can turn around a result in about 24 hours, but it all depends really on collection time, transport time, and the location where the person is being tested. So those are my comments, and I would turn it over to whoever is next. Tim, do you want to make some comments?
Well, thank you for the opportunity. I'm Tim Wiedrich of the State Health Department. We've had a substantial amount of PPE that lies in a state medical cache. We have begun over the last 4 weeks or so, been distributing portions of that. We still have in excess of a million N95 masks, which seems to be the area where the most acute shortage is being felt for public health and medical providers. And so there have been a number of steps that have been taken to make sure that the medical system, including the specific materials, are appropriately stockpiled within our state. Well, there's so much more that we could be talking about, but I think that we're probably close to the question and answer period at this point. And so in terms of moderation, so let me go ahead and open the floor now to see what questions or comments you may have. Members of the press, if you would please speak up at the time that you're asking your question as loudly as you can. We do have a microphone at the front, but I also will repeat the question just to make sure that everyone can in fact hear.
So I have a question about the first case. Can you say where and when the man traveled?
So the question is about the first case, where and when did the man travel? Kirby?
So the individual did travel out of state. They traveled out to the East Coast, and that's as specific as I'm going to get right now. But they did travel to an area where there is transmission in cases that have been identified. So.
Can you say when that was?
He traveled in March here. So.
You've all talked about the community's role in preventing the spread of this disease. There are some events happening this weekend, for example, state basketball tournaments. Is there any concern or direction from your offices on what the community should do to possibly avoid crowds in those situations?
Oh, yes. Okay. So the question is, we talk about the community role in preventing spread, and there are a lot of sporting events going on this weekend, and so there are some things in some guidance that we sent out, and we have been in frequent contact with the North Dakota High School Activities Association, and they issued a statement as well, but they are doing things that I think are really appropriate for where we're at in North Dakota. They're making sure that their bathrooms are equipped with the soap, and so people can wash their hands thoroughly. If the venue has access to hand sanitizer, they're going to make that available. They are encouraging individuals who may be at high risk to maybe enjoy their sporting events on TV, and then so those are some of the things that are important. And encouraging, of course, people to watch at home if they are sick. So they are doing and taking some proactive steps, I think. At this point in time, we'll just continue to be in dialogue with them because, as we mentioned earlier, this is a rapidly evolving situation. So.
I have a question about the tests. You mentioned that the public health lab is managing the tests. So is this available throughout the state, or would people, if they contracted in a rural area, have to travel to Bismarck to get tested?
So in order to be tested, and the question is the testing available throughout the state? And the short answer is yes. However, it is considered an invasive specimen. There's specimen collection procedure when you put a swab through somebody's nose, and so a provider has to do that. And so they do need to seek care to get that specimen collected. And it's important for them to be evaluated by a provider if they think they have this. And so that's an important part of this. So.
Maybe you want to clarify. Collection takes place statewide, but the analysis occurs.
Right. Yes.
Any
Okay.
rural hospital could handle
Yes.
the clinic or what have you.
Yes. Yes. Any.
Similar to like getting a
Right.
flu. It would be
Yes.
similar to like getting, if you went in and said, hey, I don't feel well, then they might test you for influenza A. They take a swab. They have to send it to a lab. In this case, the only lab right now that can confirm the coronavirus is state lab. So if it was collected in another location and then sent here, then that's when the state would do it. State would confirm it or not.
What is the state lab's capacity to test right now?
So, and that's the million-dollar question in that testing supplies in the United States as a whole are limited. We are working on, right now we are working on different methods to do testing, and so once we get those validated, our testing capacity will increase. But right now, it's fairly limited with the methods that we have available to us. So.
And who right now is eligible for testing?
So the testing criteria is we did loosen it up a little bit from a couple weeks ago, and the testing criteria continues to be based on risk, travel history, or exposure to somebody who has COVID-19. It continues to be based on symptom severity. Those people that have severe illness, but we don't understand what's causing that severe respiratory illness. In other words, influenza has been ruled out, or respiratory syncytial virus has been ruled out, those types of things. And then it's also, we take into consideration, is the person in a vulnerable population are at high risk for an outcome, or does the person work with individuals who are at a high risk for a severe outcome? Those are all things that we take into consideration when we do testing.
Of the demands in testing in North Dakota right now, is the state lab able to meet it?
Our current demands, we are able to meet those demands. You know, as this ramps up, though, you know, it's possible that we will become more limited in our supplies. So, yeah.
There's this effort to secure millions of dollars in federal funds for the state's response. Is there a plan on how that would be spent so far?
We have developed a plan, and basically there are several areas that will be addressed by the funding. Obviously, that planning is ongoing as the circumstances continue to evolve, but there will be substantial investments in diagnostic capability. There will be investments in personal protection equipment for the medical providers, and there will be investment in staff time as well. There are other ancillary portions of that as well, but that will consume the majority of the funding that we believe will be available to us.
Are the tests covered by that, or is that going to be insurance covered, or how is that handled?
So I can provide a direct answer that it does provide for some levels of testing, but there's also private pay that commingles with whatever funding sources exist, and you know, there's some evolving in terms of as the private insurance market or providers are doing things like waiving copay and so forth. So that's more of an evolving situation as we're moving forward.
And I wanted to move a little bit to the kind of panic going on and the shelves being emptied of toilet paper seemingly all over the country. What should people be buying? Should they be buying toilet paper, and if not, what should they be buying?
Well, if I could just quickly have the governor address that.
Yeah, it's unfortunate to see the level of response to that we're seeing around retailers, and even some of the actions that would maybe be considered criminal. We are emphasizing not to panic. Yes, we want you to do all those things about being prepared and taking care of your health hygiene, and all of those things are true, but rushing out and eliminating all the stock within the stores is not an appropriate measure, especially where we are today.
And I would just say, you know, one thing, there's no evidence at all that the coronavirus can be transmitted through water. In North Dakota, we got super safe water supplies. I mean, I know a lot of people like to drink water out of a bottle, but water out of the tap in North Dakota is completely fine. And so, you know, one of the least effective things to do to be rush out and buy a bunch of bottled water, because, you know, water supply in North Dakota is completely safe and will be, and that might just be a bad use of your own personal resources to do that.
Governor, would you say it would be too early for your office to be looking at potential economic impact if there were to be more people staying home from work and the spread of the virus?
Well, on economic responses, I think those are appropriate, and I think, you know, what we saw last night in the presidential address, I think is appropriate to call it unprecedented for this early in a situation, to be talking about the size and scale. I think some of the things that Congress is going to be meeting today, but some of the ideas that have been forwarded, whether it's SBA, Small Business Administration loans to help small businesses that are affected, the moving back of the April 15th tax deadline. That's the April 15th tax deadline. Americans write checks to the federal government. It takes capital out of our economy. You move that date back, that could have tens of billions of dollars of resource that stays in the economy as opposed to being shifted to the feds. And so I think that's an idea which I'm sure will get a lot of traction. It sounds like that's moving forward. If you take the sum of all of that, I think it was mentioned last night, about $250 billion of stimulus, and that's I think again trying to soften the impact of this, particularly if the government is going to play a role where it starts it starts interfering with markets. If it says, hey, airlines, you can't have passengers come from Europe, then if a government decision to protect citizens during a period of emergency is going to affect them economically, then I think that it's appropriate for that same federal government that created that rule to say, how do we support them during this time of transition? Because if we have businesses that start to collapse and the economy start going sour, then that also reduces, again, may reduce people's access to insurance. It may reduce their ability to serve health care, and then it becomes counter to what we're trying to do, which is focus on the health and the well-being and the safety of American citizens. So I'm very happy to see that we're approaching this as both a health and an economic crisis, as opposed to just a health crisis.
So on the note of the economy, the oil industry right now, of course, is really concerned about falling prices as a result of the virus and recent news by OPEC and Russia. How are you feeling about that, and what sort of steps is the state taking to prepare potentially for falling revenue?
Well, two questions there, and the first one is related to the global markets, and I would say it's maybe the perfect storm has been overused, but there is a demand shock that's occurring right now, because when you start restricting travel, then you restrict demand for transportation fuels, which are primarily oil, as turned into gasoline or aviation fuel, and so you are reducing demand. The early estimates, a month ago, was that if you had a global pandemic, that it might drop the demand for oil production by a few percentage points, as opposed to having it go up by a few percentage points on a global basis. And roughly, it's a little over 100 million barrels of oil a day are consumed on the planet. Well, if you say, okay, it's going to drop by a couple percent, it's going to drop by a couple million barrels a day. OPEC has in the past had the ability to go and say, we're just going to limit production. If they limit production, and Saudi Arabia is usually the one that stood up, as they always traditionally were the world's largest producer. Now the United States, thankfully, is the largest producer. But Saudi Arabia could say, hey, we'll drop our production by 1 million barrels a day if everybody else drops collectively by 500,000, and then demand and supply stay the same and prices stay firm, and you go forward. What happened was that when they got together and had their meeting last Friday to say, hey, should we figure out a way to reduce our supply to maintain prices, there was a well-publicized disagreement between Russia and Saudi Arabia, and then Saudi Arabia took action to start initiating a price war, meaning dropping the prices, and then that led to a collapse in prices. And so then we're in a situation where, again, some of that price war is not really related to the coronavirus. It's beyond, the price has dropped beyond what the supply demand would be, because we've got two countries that are fighting over market share. And that's a good thing for, if you're an industry that can, if you're a consumer and you put gas in your car, low prices are great. If you're a nation that is, highly dependent on importing oil, that's a great thing. I mean, if you're Japan and you've got 128 million people living in the space of North and South Dakota, and you only got 4,000 barrels a day of production, compared to like 1.5 million of North Dakota, it's a good thing for Japan, because low energy prices help some people's economy. In North Dakota, as a state that's got a significant dependence on oil revenues, not a good thing for us to have prices that are too low. And the good news is, when we go back to when Brent and I took office just over 3 years ago, the state general fund was $6 billion. Working with the legislature, we cut it down to 4.3. So just like a family trying to live within their means, I mean, that was substantial to reduce the state spending by 27% on that first go round. So we don't need as much revenue to keep operating government in this last, but that was, we took some pretty dramatic steps. I mean, no pay increases for state employees, cutting lots of capital expenditures. In the last go-round, it raised back up to about $4.8 billion. So we're still $1.2 billion below what our spend rate was when we took office. And so the good news is we're spending less. And then we also, through, again, working with the legislature, built back up all of our savings accounts. And so we've got the Budget Stabilization Fund at its highest possible level, in terms of legislative maximum. And then we have a we also, because we forecasted conservatively through February, I mean through the first 8 months of this biennium, we were running 7% or almost $200 million ahead. So we've got a cushion in our forecast because we were ahead on revenue by $200 million. We've got a significant cushion in the budget stabilization fund, and so we are in a position to be able to sustain low prices for a while. And so if we're talking months or the rest of this year, we're in good shape. If this goes on for 18 months to 2 years, then when the legislature gets back in January, then we'll have some tough decisions again about where we have to figure out how to reduce spending, because the shale producers in North Dakota, the entrepreneurs and innovators that created that, which led to U.S. energy independence and security, are also the people that pay the bulk of the tax bills in North Dakota. So we are tied to that, definitely tied to that industry. But I'd say we're in good shape where we are right now, and then we'll see if OPEC and the OPEC members sort out the spat that they're having, because both of those countries also have budgets, and when they're trying to inflict pain on each other, they're also putting themselves in the same situation that we are in North Dakota, which is they probably don't have revenues to meet their expenditures, so it's not sustainable for them to do that kind of price war forever either.
I have a question about sick leave. Kirby mentioned that 14 days if you're ill is a good amount of time to stay home, and I just wonder if people don't actually have that sick time, they're more encouraged to go into work anyway. Is there anything that WSI or any other state agency is doing to improve sick time for employees?
Well, this is something we'll continue to take a look at, but and the feds as well. The feds are talking about doing some kind of compensation for people that are staying home. I would encourage employers, because I want to say that there's a free market solution for this, but if you have a period of time right now where we've got the lowest unemployment in the country and you want to keep your employees, most employers probably should figure out a way to let them work from home, stay from home, pay them from home, whatever, because the cost of not paying somebody and losing an employee, because if that you don't pay some employee, they stay home for 2 weeks, there's 30,000 jobs open. That employee is going to go work for somebody else that is willing to pay for your time at home. So I think that there's a market solution that is going to, I think, really it's in favor of the employees right now, because of the labor market is being so tight and people with skills in such demand that smart employers are going to figure out a way to take care of the people they have right now versus trying to get in the market and rehire and retrain. So I feel like, again, this is one of the benefits of a super strong economy is the fact that it's strong economies are great for all the workers in our country. I mean, before the cloud of the last few weeks, February, the United States created 267,000 jobs in February. Yeah, January and February together, that exceeded what most of the forecasts were for job creation for the whole year. So right heading into this thing was still an indication of just how strong the labor markets are, which is a really positive thing.
One more question, then you'd mention the hotline as well.
Okay. Somebody want to do the hotline, and then while they're thinking of their last best question. General Dorman, anything that you want to add?
No, I'm good, yeah.
Okay. We know you're good. Thank you for being here, and thanks for you and your team and everybody, Cody and everybody in emergency services gearing up to be able to help us through this hotline. Who wants to take the hotline question?
We're having the number.
Okay, all right.
It's on its way to the front. Miley, do you want to?
So we have set up the 24-hour hotline. It is available. This is for the public for questions related to COVID-19. It's between 7 and 7, Monday through Friday right now. This hotline number is 1-866-207-2880. I'll repeat that, 866-207-2880. This is for the public if they have questions related to COVID-19. Right now it's running Monday through Friday, 7 to 7. And let me just emphasize that this is for the public, should they have questions, to call us at the Department of Health about. If you have symptoms, if you have contacts that you've made, you should be talking to your medical provider. That is our first request. If you don't have a medical provider or you need assistance, call us, please.
Other questions?
One more, I think. For Mylin, you mentioned your office sending the memo to long-term care facilities, urging limiting visitation. Is that a mandate or just a suggestion?
It is a recommendation. We will be supporting that recommendation, and we believe that they are taking steps and measures, but we want to be able to support them in doing what we think is the right thing.
Let me just clarify by support is that we will have teams in North Dakota making physical checks at all 80 skilled nursing centers to make sure that they're implementing the recommendations. So it's a strong recommendation to help protect those most vulnerable here in the state.
So, Governor, if I could just kind of amplify that we are today going to be communicating further with the long-term care industry to basically add greater clarity to the topic we're talking about now. I do want to thank everyone for coming, and please stay safe. Take care.